are never going to be 100% effective. In fact, we are happy with oftentimes 80%, 70%, 60%. So again, this 100% is really quite groundbreaking. Now you have to remember that this is for a very specific type of rectal tumors. They have a specific genetic mutation. So out of the 45,000 Americans diagnosed with rectal cancers that Eric mentioned, only about 5 to 10% of those rectal tumors will have this genetic mutation, therefore potentially have the same response to this immunotherapy. But immunotherapy, that we're making headway with this. We are treating so many cancers: lymphoma, leukemia, lung cancer, breast, so many others. And that's why ASCO in itself, it wasn't just this one medication. There are so many more that we are very excited about. We are really in a new generation of treatments when it comes to cancer treatment, and I can tell you that the cancer diagnosis is not the same as it once was decades ago. There are so many early detection methods as well as treatments, and hopefully we can give these patients the hope and quality of life that they deserve.
We are making leaps and bounds, no question about that.
Thank you for watching.
Another drug that's being described as unprecedented out there, Doc, it's called tirzepatide.
Thank you, Lord.
This is a diabetes drug, but it's also shown remarkable effectiveness in helping people who are obese
now
lose
diabetes
weight.
drug.
People who took the maximum dose of this drug without doing anything lost 22% of their body weight. How promising could this be for folks who are obese, and maybe one day could it just become a standard weight loss treatment?
Well, another exciting drug, John. So the tirzepatide is already FDA approved to treat type 2 diabetes. And in those subset of patients with diabetes who are overweight, it was noted that they did have a weight loss. About 15% of their body weight, they had reduction. Now, what the study that just came out, also in the New England Journal of Medicine, showed is that patients who are overweight and obese who took the medication and didn't have diabetes, they actually had an even greater weight loss, about 20%. About 2/3 of patients were able to lose about 20% of their body weight. That's huge, especially when we know that obesity and being overweight is directly linked to a lot of medical conditions. And so if we are able to help these patients lose weight before they develop these comorbidities, that's a win. But I can tell you, it's not just about the medication. And even in the clinical trial, patients had to adhere to a certain diet and increase physical exercise. But when you only do diet and exercise alone, you really only expect to see a 5 to 7% weight reduction. So by the addition of this medication to have up to a 21% weight reduction, that is incredible, and this will really help Americans with the obesity epidemic that we are suffering from. We have to get to the point where we are preventing chronic illness and not just treating it.
An obesity epidemic.
Thank you for watching.
Really
Please subscribe if you didn't.
Pandemic, as we spoke a lot about, Dr. Sapphire.
God bless.
The process,
see you on the next one.
42%. The prevalence of obesity from 2017 through March of 2020, and we know that did get worse. Just final question here. It apparently led to weight loss of between 35 pounds to 52 pounds, depending on the dosage. That's really serious weight loss. You would think that would be a weight loss category, not for somebody just trying to lose 5 or 10 pounds, Dr. Sapphire.
Absolutely, and nothing should be done without being under the supervision of physicians. But you have to remember, the people who were in this study were obese, and so that is going to be an appropriate amount of weight being lost. Usually, only that kind of weight to be lost will be seen with surgery, but this medication was able to provide it without an invasive surgery, which would potentially have some complications. So in that sense, it is very exciting, but of course, nothing should be done without the supervision of a physician, as severe weight loss is not healthy for anyone. It can also have its own consequences.
Thank you for watching. See you next one.
Thanks for kicking us off, Doc, with some good news for a change. Appreciate it.
Thank you, Dr. Sapphire.
Thanks, guys.
All right.